So this is my friend, Dr. Mark Tall. He's been a dentist for 35 years. Graduated from dental school in 1988
from Case Western Reserve University, Wheatland, Ohio.
when I was 10.
Huh? Yeah, when you were 10.
I was in elementary school.
Oh, man. Yeah, I had a lot of my friends are that way. Seriously. They're a lot younger than I do. We just, Bradley County, I love hanging around those guys because they like doing what I like to do.
Well, I've been wanting to sit down and talk with you. We talked last week. I had a PA on there where we talked about sleep, and we got into some of the neurochemistry and some of the brain waves of sleep. And I've been dying to get you to come in and talk because, well, if I'm being frank, the CPAP business is way bigger than it should be. Yeah, and you've got an option here, an alternative that can get people away from that.
We're getting results, and the results are staggering. They really are.
Okay, so backing up a little bit, you practiced for 35 years. What in the world made you decide that it's time to sell your practice and start the new case?
That's a good question.
Sleep Idaho Falls, right?
Sleep Better Idaho Falls. And it is a great business. People just don't know we're here.
Yeah.
We haven't got the news out. And we're just barely getting going. We just barely opened a new office. Used to do it in my dental practice, but now I don't. I do it in a separate office so I don't feel so threatening to the other guys that want to refer. And that I do welcome because we do have a system that works. We've treated in our office probably 60 patients at this point, of which I would say every single one of them had a positive result. The most staggering results that I've seen so far are those that widen the palate and bring the face forward a little bit more to actually grow the airway. And you can do that with stem cell research and everything else that's come through. That's amazing what it does. And so when I came to get you for my knee, that's where I was going. Stem cells, it's got to be there. It's got to be able to do something without surgery. This is non-surgical, non-invasive. It's not to the point where it doesn't hurt or anything like that. You still have to go through a little bit of pain to get to where you need to get, but it's very real. One guy his airway was open about the size of a stir thing that you put in coffee, a little stirring stick that you put in there, and we grew it to the size of a garden hose, and that's where it needs to be. Your airway needs to be the size of a garden hose to breathe effectively. If you can get that, you can give them a life and give them another 12 to 15 years of life and enjoy your grandkids, enjoy what you're doing, enjoy life.
And that's just not other guys, not have to drag a machine with you.
Yeah,
you go.
You don't have to do that. You have to pull it out when you go to the airport. You can travel, you can do things. And it's a device, it's this big around, that's it. You put it in your suitcase, put it in when you sleep at night. And
so the device actually goes in your mouth.
Device goes in your mouth.
Okay.
Yeah.
Explain to me what that's like, what you're trying to accomplish.
Yeah, there's two different systems that we use in our office. One's made by a company called Vivos, which I believe in a lot. And the other one is made by a company called IAOS, which is International Sleep Academy. And they are incredible too. The business model on IAOS is better than for Vivos, but Vivos is very well known because they do grow airways. And it is very, very good. Dr. Singh has been very, very well with Vivos, and Dr. Abi, he sits down and says, no, this is what you need to do. And his main mission is to get it out more to more people as far as what sleep apnea is and be aware of it.
Okay, so according to you said Dr. Singh?
Dr. Singh, yeah, for Vivos.
What is his definition? I'm assuming it's a him.
Mm-hmm.
That was very Texas of me.
No, that's very good.
What is his definition of sleep apnea?
His definition of sleep apnea is knowing how many apnea you have in an evening. How many times do you stop breathing, if you're wondering what apnea is? And basically, if you're not breathing for more than 1.5 to 2 minutes, you could basically just pass away and nobody would even know. I've had, I think, in my practice alone, I've had probably 3 or 4 patients that I didn't recognize had that problem and didn't know they wore a CPAP, didn't understand what that purpose was in my practice. I don't have that problem in my practice. I had 64% of my practice having some type of apnea at night. And close to people, wives coming in and saying to me, or husbands coming in about their wives, saying that, well, that's sexist too, right? It's not just males, but it's females also. And they snore, so do guys. But they're sitting there saying, my husband stops breathing. And it's very alarming. 2.5 minutes. I can barely see, maybe on my fingers, 10 people that can hold their breath that long. And they don't know they're doing it in their sleep. Whoa, they have no idea.
What causes it?
It's a myriad of things. It could either be sympathetic, parasympathetic type reactions there. Mm-hmm. It could be airway restrictions. Mm-hmm. It could be the tongue going to the back of the throat as you're not breathing, and it cuts off the breathing. And it's just there. So, but those are very obstructive. That's obstructive sleep apnea. And some of them get different types of sleep patterns from those. Mm-hmm. And some of them are damaging and some of them really aren't. And people just don't know. And they wake up and they're going, why don't I feel relaxed? Why don't I feel more energized? Why do I not feel like I want to function? I want to go back to bed.
Because they've been fighting to survive all night instead of resting.
They have had a workout all night. And their heart rate's up. And they're wondering, what is going on with me? I don't know that I even have a problem. And next thing you know is I'm going, you got sleep apnea. I can solve that problem for you by just doing a simple test. And some of these things I brought for today to look at that type of stuff, I look at that and I go, this is where you're at. And I give them this test and they say, answer these few questions for me, would you? And we'll get a score. And then we'll give you a sleep test afterwards if it calls for that. It's not always something that you need to do, but it gives me a real good indication of, wow, I really do have a problem, don't I? Yes, you do. This is what we can do to correct.
Wow.
So it's kind of crazy.
So tell me about the testing process. What is that like to figure out if this is a good fit for somebody?
Basically, you're answering a few questions, and those questions are simple questions. And I brought one test with me. It's called the Epworth sleepiness scale, asking simple questions like, how likely are you to doze off while doing the following activities? Oof. Okay. Being a passenger in a motor vehicle for an hour or more. Are you asleep or are you still awake? You didn't know that, did you? Sitting and talking to someone, that's kind of embarrassing. And I've seen it. Sitting and reading, watching TV, I do that. Sitting inactive in public places, lying down to rest in the afternoon, sitting quietly after lunch without alcohol, go figure. In a car while stopped for a few minutes in traffic. And I've seen that happen. And we've all seen that. That's just part one. Part two goes into a little more deeply. Have you ever been told you snore? Right? Do you wake up choking or gasping? Do you have high blood pressure? Do you have diabetes? Have you ever experienced an irregular heart rhythm? And those have scores that come along with those. And if you're up there, you're there. Does snoring cause any problems at home? Interesting, isn't it? How is that with your family? Would you like to fix that? And then it goes through, you're talking neck size, you're talking BMIs as far as what the body is. And Malin-Potty, you have all the way from class 1 to class 4. And those are just our...
I'm not, but what is that?
If you look in the back of your throat, like that,
okay,
and you can see the tonsils or the uvula, and if you can't see it, it's class 4. If you can't see it, it's class 1.
Okay.
And that's a very simple thing as far as obstruction or non-obstruction. There's ways you can solve that. Number one on the list is to send them in and see if there is something wrong with them physically through an ENT specialist. So the physicians play a huge role in this. They are the ones I think that really picked it up at the very beginning and said, there is a problem here. We just don't see it. And so they can fix those problems by surgeries. And those are a little more severe tonsils that are obstructive, where it blocks off the whole back of the throat. But the simple stuff is just by laying down, going to sleep, putting on a sleep test, and seeing what you come out with. And you get an AHI, which is an apnea test that tells you how many times a night you stop breathing.
Is this a test you do at home or in a lab?
Both.
Okay.
I like the ones that go at home because you actually sleep.
Right.
The ones in the lab, they wake you up every hour. And I'm still going, why would you wake up? Because I want to know if they're sleeping or not.
That sounds terrible.
So the sleep tests at home are very simple. They're in familiar surroundings.
Mm-hmm.
They actually lay down and go to sleep. And they wake up in the morning and they go, still not feeling different after taking this test. And I send the test in and they come back with different types of numbers to give us things. Apnea numbers, AHI is that. It's an index. And if it's around 0 all the way up to 10, it's mild. 10 to 30 is moderate. And anything over 30 is severe. We have appliances for each one of those situations, and we're getting studies back at this point over a 10-year period, sometimes even more than that. And they're telling us now that you can have these severities recorded. Here it is. This is what we can do for you to correct that. We can go from a severe case all the way down to a mild case just by treatment with an oral device.
Holy cow.
So
I'm thinking about this from my practice perspective, right? Because we've, with our weight loss program, I tell people all the time, if we were being 100% honest in our advertising, we'd advertise it as an anti-inflammatory / autoimmune weight loss program because you're consuming foods that don't create all this inflammation, right? So we have a ton of people that lose weight and they sleep better, and then some of them even come back and say, I don't need my sleep or my CPAP anymore. I'm just thinking of the whole obstructive pathways and how much diet, sympathetic response, stress would all play into. So that's fascinating.
I'm glad you bring that up because one of the things that we do to make it better as far as the apnea index to lower is to lose weight. We are all, as Americans, they say we're overweight. Right. And so your program is vital to what I'm doing. Do I refer a lot to you? Absolutely. I tell everybody, go over and just sit in his class, listen to what he has to say, and lose some weight. But I don't want to insult anybody either.
Right.
That is a choice. And it does say it all over these papers. It says it everywhere. Obesity is number one cause, I would think, or some of the causes, among other things, that actually cause sleep apnea. And how do I know I have sleep apnea? What is it? There's in the brochure here that we pass out. You have anxiety, headaches, diabetes, cancer, hyperthyroidism, chronic fatigue, aggressive behavior in children, bedwetting, ADHD. We all think that that's just normal stuff. So we give them medicines.
Right.
And it's all because of sleep. Teeth grinding, asthma, mouth breathing, because they just can't get enough in. And we got a lot of things to support that. You've got depression, snoring, dementia, hyperthyroidism, fibromyalgia, and cardiovascular disease.
All linked back to sleep apnea.
Every single one. And they go through this program, they wear this device, and they walk out of here a new person. They really do. With Vivos, I find that the program that they put us through is more of a curing. I want an end to my treatment. It takes 12 months to 18 months to 24 months, and no more than that, to get you to have to not wear a CPAP or an oral device to be normal. And now that's Vivos. As far as IAOS, I still think they're saying you have to wear that device because they don't have that cure. But the numbers are going down. The AHI numbers are going down. An index is indicating to me that, wow, how do we know that? Because after a year of treatment with them, with the IAOS system, I do another test in the year. Same thing with Vivos to say, this is working for you. What do you think? Man, I feel better already. I want to go on with life, but how do I have to wear a CPAP for the rest of my life?
Right.
But you get it, because that's what the physicians are saying to us right now, because that's the only thing we're familiar with. They're not ready or wanting to accept, or whatever it may be, or don't know about it. This OATS, which is an oral appliance therapy, is the answer. As far as I'm concerned, people don't want to wear these things. They don't want those masks on them. Sleeping next to Darth Vader, that tells me a lot. And that's what it sounds like. Why would you want to do that? That's where I'm at with it. And does it really do any good? You think about what that mask is doing. It's pushing your airway back, your face back, and maxilla and mandible back.
Well,
blocking it off more.
I would venture to argue that a lot of the sleep problems that we have are driven by sympathetic responses. People are in fight or flight all the time.
Absolutely.
And you put a freaking mask on, it may be creating different air pressures and things that are helping you breathe, but at the same time, you're still driving that sympathetic pathway.
Yeah.
You know, for me personally, I quite enjoy sleeping in a tent in the middle of nowhere.
Yeah. Nice.
I can't take a CPAP when I do that. I went on a float trip with somebody, and my brother, he'll never listen to this, so I don't care. With my brother, and he actually put a battery pack that was about so big into the boat that we had to lug around so he could sleep with a CPAP at night.
Mm-hmm.
You know, my father went to his grave sleeping with a CPAP. I'm not going to do that. There's no way.
Yeah. All right, same way. We were in Alaska 26 years ago. Holy smokes. He came with his brothers. His brothers found out that he had sleep apnea, sleeping with the CPAP at night. Hey, Mark, would you mind if my brothers slept with you guys? In your quarters there? No, not a problem. It's okay. Found out that just before he went to sleep, he says, hey, guys, I got a little bit of a problem here. I got to sleep with this device. And he had that thing on all night. I says, okay, this is enough. You're back with your brothers. I didn't go on this trip to have this. But he needed a CPAP machine. And like you say, it was a powdery back, and it sounded like Darth Vader sleeping next to her. It was all night long. And I was just kind of going, do I really need that? And I started relating that to what my patients are doing in my practice, started asking the questions, because the American Dental Association has come through back in 2017 saying, ask the question, how do you sleep? It's a very simple question to ask. And a lot of dentists don't want to ask that because they're there to clean their teeth, right?
Right.
Hygiene department is the best place to start. And to get them to see their dentist 2 years or every 2 times a year, and to be able to have those questions answered is vital to what that person's health is going to be. And you'll find out what's in your practice and what's not, just by asking, how do you sleep? Oh, I sleep with a CPAP machine. That's horrible. I hate it. Do you wear it all the time? No, I hate it. Why? And they tell you why.
Yeah.
You know, and we give them an oral device. Is it better? Yes, because you can actually sleep at night. You can do things. It's a mandibular manipulator, and the manipulation is bringing that jaw forward so it doesn't block off the airway, or allow the tongue to go back to the back of the airway and block it off.
Does that affect nasal pathways as well?
Absolutely, because everything goes right to the oropharyngeal cavity.
So even
where it goes.
Wow.
And it blocks it off. They've got this synergy now it goes in, and it actually goes a surgical procedure you go through to stimulate that, to bring the jaw forward and to bring the tongue forward by stimulating it to get it out of the back of the throat. And that works really well. I got some people that really like it, and other people that look at it and go, I wouldn't wear it. Why did I do this? I don't know. I said, I got the oral device that will cure you in about 24 months, 18 months at the most.
Wow.
And would you rather do that and not have to wear it anymore? Yeah, I'd much rather do that. And I've got probably 22 people right now that have gone through that, and they're going, well, you're giving me my life back. I can enjoy life, I can enjoy my kids, I can enjoy my family, and I could be me. And that's really what I'm doing for. We're watching now for all of you, just by those questions we just asked and those symptoms and everything going on. And we think we need to put people on medication. We don't need to do that. You can do it just by giving them the opportunity to grow an airway and get back to normal. And there's a cure.
Do you have that questionnaire in a PDF?
Yes, I do actually.
Okay, I'm going to send it out with my people. To my people, when
I'll have Crystal send it over.
yeah, that'd be awesome.
It'd be
So the takeaway here is sleep apnea is a big deal.
yes, it is, and it's an epidemic as far as I'm concerned.
Epidemic. It's shortening people's lives, decreasing the quality of their life.
You say that right on, because the reason why I went into sleep at this point in my life, I want to retire at some point, but I don't want to because I know there's a need for this. I stopped doing dentistry. I sold my practice. The person I sold it to doesn't want to do sleep apnea in his office.
Mm-hmm.
And I says, well, that's okay too. I'll go and do my own thing then, and we'll make this thing happen. And I'm looking at that like, is this changing lives? Yes, it is.
Right.
Is it something that's there that will give these people a chance to know what their problem is and have answers for it? Yes. A lot of people don't know they even have sleep apnea. If you snored, that's an indicator. If you are waking up at night, that's an indicator.
Right.
For choking and gasping, for falling sick, we just learned all the stuff to that simple test that we just talked about. I'm looking at that like, why wouldn't you want to have some form of normalcy in your life? And where are we? We're doing that. There's no reason why we shouldn't. It really is.
So mind blowing.
Yeah, it blows me away. So I do full mouth reconstruction cases, and cases I put crowns in. We open people's airway up a little bit. But I was finding, Mark, I still can't breathe. Can you help me?
Yeah.
And I said, okay, that's an answer for me. That's an answer to something that's wrong. And they were telling me that before. Wow. Because I didn't ask. I didn't know what to ask. But now I do. And I ask it all the time. Do you breathe? How do you do at night?
I've answered positively to a couple of those questions.
Yeah, me too.
So,
and it's kind of scary.
Yeah.
And have I gone through treatment? Absolutely. Because I know the value of it. And it's helped me, and my wife tells me, you don't snore anymore. I've also lost weight. I've also increased my ability to get out and play more with my kids and my grandkids. Love it. And they're all going, how old are you? And I still ski, and I still motorcycle, I still do these things. I'm probably not like I was when I was 35.
Right.
But I'm still able to do it at my age, and I still have a life.
That's awesome.
And I'm not carrying around some big butt like everything else.
I think about it too, as far as, going back to our weight loss program. I tell people one of the benefits of our program is that you don't have to keep buying stuff from me to keep the weight off. You have to keep doing these things. But if they were sleeping better, I would even add more.
It's a recharge.
Yeah.
But weight has everything to do with it too. It really does. And I try not to make that my first one, but it is part of the process. How much weight have you lost? I feel better at night, so I lose weight automatically.
Mm-hmm.
And the program that you have helps them eat better, nutrition. I'm a big tiny nutritionalist too. I love to see people eating properly. I didn't do it my whole life, but the last of it, and get older, and I'm understanding what nutrition is in my life and what I put in my body. Man, it has a huge factor. And we're eating way too much sugar.
Right.
We're eating way too much stuff that is processed, and it's hard to find good food and people that really want to feed you that way.
Yeah. Well, that's why you have to do it yourself.
That's why you have to do it yourself at home. And you cook for yourself. You do for yourself. Processed sugars are horrible. But nutrition, I became more aware of that as I'm getting a little bit older. And I feel like I'm more healthy.
Mm-hmm.
I feel like I'm doing things a lot better. My wife has been wonderful because she cooks for me and does things and makes sure that she wants to get. And since I'm married, I've been married to her for 10 years. My first wife passed away, and her husband passed away, and we're both looking at each other like, let's get healthy. No, I don't want to do that. I still like eating ice cream. I still like doing all this. Right. I eat it every night. All stuff. No, Mark, we need to stop eating sugar. She was a big advocate. I'm going, okay, what is it that you're trying to get? And for whatever reason, I said, something, you're right. I got to stop doing this. Treat myself better.
Yeah.
And because of that, I dropped maybe 20 pounds just by stopping eating sugar.
Yeah. Yep.
And then I went out of a program, a nutritional program, and your program is perfect for that. And I sit there and say, let's put this whole thing together. And so we talked about doing this for a long time and making sure that this is a good advocate for what we're both doing. And I'd say, something? All I got to do is ask the question, we have answers. But you have to know that it's very simple and very, very straightforward as far as what you can do for treatment. It's just a matter of an oral device. You don't have to wear a CPAP.
There's no battery at all.
No batteries. Yes. And like the ever-ready battery, right? But I look at that and I go, yeah, you're exactly right. And you just go and wear this device. You will be a different person. After, I would say, about 3 or 4 weeks, you'll start dreaming again. You'll get into REM sleep, which we're all looking for. And you'll be relaxed and energized when you wake up in the morning. And a patient walk in, just lethargy. Man, I can barely even function in the morning. I feel like I need to go back to sleep again. Well, I wouldn't do yet. Get rid of it. No. I give her one of these devices for my AOS. And next thing you know is she comes back in, she's bouncing off the wall. She goes, what did you do to me? Says, we gave you your life back just by breathing. If you breathe, you recharge. That's awesome. And you're there. And you've lost some weight, haven't you? Yeah. I'm not on a diet, though. You don't have to be on a diet if you don't want to be.
Right.
But I can tell you right now, nutrition, if you eat these foods and here's your new program that you want to do that with, that's a hard diet to follow. Everything has sugar in it. I says, yeah, tell me about it. I'm living it too. So there we are.
You think with our diet to follow, try being sick.
Yes, exactly. And it's tough.
This is awesome. Tough. Like my mind's just reset. It's like metabolism, right? This is what we're helping people with.
That's what exactly right.
We reset people's metabolism. The definition of metabolism is glucose plus oxygen equals energy. I'm doing the glucose part. You're doing the oxygen part.
Yeah. Yeah, everything's there. It really is there, and it's very real. We know that. Do you know that you actually have a problem? If you do, come and talk to us. Both of us, for that fact. If they come into my office, I'll tell them, go to nutrition. I refer them over to you, and vice versa, because there is a definite problem, and we just don't know why do I feel the way I feel? Well, we're giving this hopefully this will help get the news out there.
Yeah.
Because the news is very important. It keeps you alive. It gives you a life. And you can have a quality of life. That's why we're doing what we're doing, right? I mean, I was at one point 225 pounds. I'm down to 170 now. And people are saying, man, you're too skinny, Tull. Yeah, I really am.
No, I'm not too skinny.
At the same time, I feel great. I feel like I'm bouncing off the walls. I can still ski. I can still do stuff. But this guy from the Swiss team, when I was up at Targhee, sat there and said, well, how did you ski like that? I want to know where you learned that from. And I told him all about it, and we had a good talk. I learned that he was part of the ski team. He had a ski team up there at Targhee. I was going, whoa, this guy, 94 years old, and he's skiing like he's 20. And I say, who are you? Just, I'm a European, and this is where I'm at.
Yeah.
I'm from Swiss. I eat properly. I eat these things. I need to have you on a video. You need to do this with that guy. No. But at the same time, I'm going, it's just a matter of taking care of yourself. It really is. And it all falls in place. And part of that is breathing and eat. And if you do those two things and you do it properly, you're there. That's why I went into dentistry. That's why I'm doing what I'm doing right now. And I love it. I really can. I wish it would be a little more busy at this point, but people just don't know we're there.
Yeah, just helping get the word out.
Just tell us what we're doing.
Well, this is entertaining, to say the least, for me.
It's good for me too.
Well, I appreciate it. We'll put all the contact information for Mark in the video itself, along with you need to answer that questionnaire and see where you're at.
That's called a screener, and the screener will let you know if you have a problem or not. And we're trying to put it in all the dental offices here in town. Some of them will accept it, some of them won't. But it's very vital.
Awesome. Well, thank you.
You're welcome. Thank you for
appreciate your time.
And thanks for what you do too, because it's both of us are kind of benefit from this standpoint.
All right, Martin. Appreciate you being on.
Thank you.